Hi guys, welcome to today's session of FMG recall. So guys, we are going to discuss the recall questions, right? So let's start the question. The questions discussed in this PPT are recall based, and the motive of this live session is to get to actual questions asked in the exam. And the final questions received after discussion will be uploaded on the PrepLadder app. Okay guys, so now see this. First question. Can you tell me what is the name of this needle? Name of the needle. Clear? So guys, the name of this needle, this is Veris needle. And Veris needle, what is the use of Veris needle? It is used to create pneumoperitoneum. Clear? So the name of this is Veris needle. Veris needle used to create pneumoperitoneum, right? There is Hassan cannula also. Hassan cannula, that is open method of creating pneumoperitoneum. But Veris needle, this is closed method. This is closed method. So this is closed method of creating pneumoperitoneum. Clear, guys? So what is the correct answer? This is Veris needle. Veris needle. Okay. Now see the next question. 4 years old boy was brought to the emergency department with complaints of melena, right? That contains melena, and that contains gastric mucosa, and there is acute intermittent pain in right iliac region. On surgical exploration, following structure was found. What is the diagnosis? Can you see this structure? So guys, you can see this structure. What is this structure? You can see this structure. So what is this structure? This structure is what? The structure is, yes, this is Meckel's diverticulum. So what is the diagnosis? This is Meckel's diverticulum. And you know that in Meckel's diverticulum, the most common ectopic mucosa, that is ectopic gastric mucosa. So most common, it is ectopic gastric mucosa. And you know that because of this ectopic gastric mucosa, what is the problem? There is bleeding. So because of ectopic gastric mucosa, there is bleeding. So this patient was having what? Bleeding leading to melena. There is ectopic gastric mucosa, acute intermittent pain in right iliac region. You know that sometimes whenever there is inflammation of Meckel's diverticulum, it leads to diverticulitis. And it mimics what? It mimics acute appendicitis. So it mimics what? Acute appendicitis. Clear? So it mimics acute appendicitis. So here you can see that's why there is pain in right iliac fossa. Clear? Right iliac fossa. Right iliac fossa. Next. Okay. Next. This question, guys, read it. Yes. In this case, you can see 26 years old female brought to emergency department. Here, face and lower limb was spared. Can you calculate the area of burn? Please calculate and tell me what is the exact area burnt. So what is the area burnt? Yes. If face is spared, no face is 9% and the lower limb 18% each. Clear? So face is spared, that is 9%, and the lower limbs are spared. Lower limbs are spared. Clear? So that is 18 into 2, 36. So total 36 plus 9. Yes, it is 45% which is spared. So how much the area which is burnt? Obviously, it is 40 to 50%. So area which is burnt, that is 40 to 50%. Clear? So this is 40 to 50%. Clear? So that is 40 to 50%. Okay. Next question. A patient with grade 4 hemorrhoids underwent surgery. Identify the instrument. You can see here. Grade 4. This is hemorrhoid resection kit, stapler kit. Clear? Hemorrhoids band kit, CO2 laser. Can you tell me, guys, what is the correct answer? Yes, what is the correct answer? Tell me. What is the correct answer, guys? It is hemorrhoid resection kit. Clear? CO2 laser or stapler kit. Tell me. Yes, tell me what is the correct answer. Have you seen the stapler? Yes. Stapler, circular stapler, you have seen. So that it's not like that. So obviously the stapler is, this option is ruled out. Next, what is the option? CO2 laser. Can you see here what we are using here? Guys, can you see here? We are applying this kind of band. So if you're going to apply the band, what happens? This is, yes, band kit. So it depends on the exact picture here. Since we are applying the band, most probably this is hemorrhoid band kit. Clear? So correct answer is C. Next, given image is of ulcer. So can you tell me what are the parts of ulcer? This one, exposed surface, that is floor, and the surface on which it rests, that is known as base. It is base. This junction is known as margin. Clear? And you know that area between margin and floor, this is known as edge. Clear? So what is this? Guys, you can see here, this is edge. So the given image is of ulcer, this is edge. So what is the correct answer here? This is edge. Clear? So this is edge. After that, this is one of the famous question which was asked many times. Following a fight between two group of boys, right? There is severe pain in the chest. Patient is having distended neck veins, dyspnea, and low BP. BP is 80/50. X-ray show following findings. What's the diagnosis? So it's very, very easy. There is severe pain in the chest, distended neck veins. Why there is distended neck veins? Because there is compression of superior vena cava. BP is 80/50. Why? There is compression of inferior vena cava. Patient is having dyspnea, tachypnea. And you can see here what? This right lung, it is collapsed. Diaphragm is depressed. So guys, this is tension pneumothorax. This is the classical finding of tension pneumothorax. Tension pneumothorax. You can see there is collapse of ipsilateral lung, shift of mediastinum to opposite side, depressed diaphragm, and the findings, distended neck veins, dyspnea, and hypotension. Clear? So classical finding, what? This is tension pneumothorax. This is tension pneumothorax. Clear? So tension pneumothorax. Now see this procedure. In this case, what you can see the bilateral kidney, you can see ureter, and the dye is going into the bladder. So can you tell me, guys, what is the investigation? Obviously, intravenous pyelogram. So this is IVP. What happens in retrograde pyelogram? You inject the dye from below, and then you take X-ray. So on RGP, you are going to visualize the side on which you are going to inject the dye. So this is what? IVP. That is intravenous pyelogram. So what is the correct answer here? IVP, intravenous pyelogram. This is also known as IVU. That is intravenous urogram. So intravenous pyelogram, also known as intravenous urogram. Clear, guys? Next, famous question. It was asked multiple times. Many times this question was asked in exam. You can see 33 years old male brought with sudden onset acute abdominal pain, constipation since 1 day, hiccups, vomiting. X-ray was done. Can you tell me what is this finding? Classical finding. What? This is coffee bean. So guys, this is coffee bean sign. Clear? So this is coffee bean, and you know that this coffee bean sign is seen in, this is seen in sigmoid volvulus. So this is classical finding of sigmoid volvulus. Can you tell me what kind of bean is seen in cecal volvulus? In cecal volvulus, there is kidney bean sign. There is kidney bean sign on cecal volvulus. In cases of cecal volvulus, in intussusception, there is target sign, meniscus sign on X-ray. Clear, guys? So what is the correct answer here? Coffee bean sign, also known as, this is known as bent inner tube. This is known as omega sign. So all these are seen on X-ray. This is sigmoid volvulus. Clear? So correct answer is A, that is sigmoid volvulus. Next, during laparoscopic surgery, when inserting the trocar for surgery, which of the following is most prone to injury? So guys, there is increased risk of injury of epigastric, both superior as well as inferior epigastric artery. So correct answer is A and B. Abdominal aorta, highly unlikely. Why? Because these are located in retroperitoneum. Abdominal aorta located in retroperitoneum. Since you are going to insert the trocar, obviously what is the most commonly injured arteries? Superior as well as inferior. So both A and B are correct. Clear? So correct answer is D. A patient with diffuse severely contaminated peritonitis underwent laparotomy and was left open after surgery. Which of the following might help? You can see here. Yes, most probably here a mesh or Bogota bag has been applied. So in this case, which of the following is going to help? vacuum assisted closure, normal saline soaked gauze, prefer closure after laparotomy, none of the above. So in this case, guys, we can go for what? Vacuum assisted closure. Clear? So here we can go for vacuum assisted closure. Second, we can use also normal saline soaked gauze. So if it's left open after surgery, which of the following might help? Prefer closure after laparotomy since there is gap and there is severely contaminated peritonitis. Yes, since contaminated peritonitis is there, it's better. Here it's better to put this normal saline soap gauze. Yes. So exact answer will be dependent on the kind of language provided. Okay. So here, if you are going to provide the exact question, we can mark the correct answer. Clear? So most probably it is B. Okay. Next. Which of the following is not related to this type of cancer progression? Can you see here? This is what? It is carcinoma lip. And most probably, if you see the appearance, it is looking like what? Looking like basal cell carcinoma. Can you see the appearance? Looking like basal cell carcinoma. Okay. So, which of the following is not related to this type of cancer progression? Duration, depth, site, stage of cancer. Yes. Which of the following is not related to this type of cancer? Duration, depth, site, stage of cancer. Guys, can you tell me the exact language? What was the exact language? Yes, because it is real. See here, exact language. Because this tumor is locally malignant. If you see, it is basal cell carcinoma. So it's locally malignant. Okay. So what is the duration? Most probably clear duration, but we need exact language. And what was the exact option? Right. So please send the language and then we will decide what is the correct answer for this question. Next, patient was brought to the emergency department. On examination, he was confused. Eye movement to pain and flexing to withdraw from pain. What is the GCS? So patient is confused. Now see, EVM. Yes, patient is confused. So it is V4. Oriented is V5. Confused. Yes, V4. Eye, spontaneous eye opening to pain. Spontaneous eye opening is not there. Eye opening to pain. Clear? So this is E2. Eye opening to pain. M, flexion to withdraw from pain. So can you tell me what is M6? Obey command. M5 localizes pain. M4 withdrawal to pain. M3 that is flexion. M2 extension, no response. So this is M3. So obviously it is E2, V4, M3. So what is the score? It's 9. So correct answer is it's 9. Clear? So here, what is the GCS? GCS is 9. Clear, guys? Next. 20 years old male patient presented to OPD with given presentation. Fluctuation in size, mild numbness, and occasional pain. What is the diagnosis? Can you see here? Whenever at joints, basically what happens, there is injury of tendons. And because of that, what happens, there is formation of ganglion. So this is the typical location of ganglion. So this is ganglion cyst. This is the typical location of ganglion. So this is what, guys, this is ganglion cyst. Okay. Ganglion cyst. Next, 1.5-month-old baby boy was brought to the OPD with complaints of vomiting after feeding, failure to thrive, not gaining weight. On examination, firm olive-shaped mass in upper abdomen. What is the diagnosis? There is olive-shaped mass. Now see, what is the age? 1.5 months. Okay, means 6 weeks after birth. 6 weeks after birth, there is vomiting after feeding. But here, bilious or non-bilious is not mentioned. Failure to thrive. And what happens? There is olive-shaped mass. Can you tell me what is this diagnosis here? If there is palpable mass or olive, guys, this is what? Can you see here? This is the diagnosis. The patient is having hypertrophic pyloric stenosis. So in hypertrophic pyloric stenosis, what's the problem? There is olive-shaped mass. So here, palpable mass or olive in epigastrium or right hypochondrium. So this is palpable mass or olive. Palpable mass or there is olive. Another finding which you can see, because there is obstruction of stomach, in this case, what happens? You can see the direction of peristalsis from left to right. So what is the correct answer, guys? Here, it is pyloric stenosis. So correct answer is pyloric stenosis. In GRD, vomiting is not there. Esophageal atresia. Here, there is drooling of saliva. Subacute intestinal obstruction, there is bilious vomiting, but there is no olive shed mass. So correct answer is B. Clear? So it is B. So guys, correct answer is B. Okay. Now see the next question. Correct answer is B. Okay. After that, you can see 30 years old female presented to OPD. Age is 30. She is having 3 centimeter lump, unevenly vacillated, and upper medial quadrant of breast, overlying skin, mildly ulcerated. Microscopic finding is given. What is the diagnosis? Let me tell you. Vacillated appearance is seen in which condition? Obviously, cystosarcoma phyllodes, and this kind of typical appearance is there. Second, because of stretching of the skin, what happens? It is ulcerated. So correct answer is phyllodes tumor. Cystosarcoma phyllodes, it is phyllodes. So this is cystosarcoma phyllodes, also known as phyllodes tumor. Clear? So it is cystosarcoma phyllodes, also known as phyllodes tumor. Correct answer, phyllodes tumor. Clear? So it is phyllodes tumor. Next question you can see. Identify the level of lymph node in neck marked. Okay. So here, can you see this is sternocleidomastoid muscle? It is in relation to internal jugular vein. So this one is, this area is marked, this one. So this is upper jugular, level 2. This is lower jugular, middle jugular, and this is lower jugular. So this is 2, 3, 4. 1A, that is submental. 1B, that is submandibular. 2, 3, 4, upper, middle, and lower jugular. And this is 5, posterior triangular. So guys, this is level 2. This is upper jugular. This is level 2. Clear? So level 1, A submental, 1B submandibular, 2, 3, 4, upper, middle, lower jugular, 5, posterior triangular, 6, central or anterior compartmental, and 7, that is superior mediastinal. Clear? So correct answer is A. Next, 22 years old male presented to emergency with chief complaints of severe urge to pass urine, right? But unable to do so. There is history of injury to perineum. Perineal injury. On examination, blood on meatus was seen, likely to be injured. So guys, there is perineal injury, and this is related to anterior urethral injury. Anterior urethral injury. Since there is blood on the meatus, right? So patient is having anterior urethral injury, and you know that in anterior urethra, what is the most common site? Vulvar urethra. It is vulvar urethra. Posterior urethral valve is a congenital condition. Intraperitoneal bladder rupture. In bladder rupture, what happens? Bladder is collapsed. Clear? And in this case, there is no blood at meatus. There is hematuria. Membranous urethra, it is associated with pelvic fracture. So these patients are having pelvic hematoma. Got it? So this is associated with pelvic fracture. Associated with pelvic fracture. So here, what's the correct answer, guys? Correct answer is vulvar urethra, because there is perineal injury. Clear? Next, a woman 2 weeks after delivery complains of bloody discharge from the nipple and fever. On examination, diffuse lump under areola. What is the diagnosis? Bloody discharge, simultaneously fever. Clear? So most probably it is related to what? Inflammation, because she is lactating 2 weeks after delivery. It is not galactocele. In galactocele, what happens? Fever is not there. Mondus disease, there is superficial thrombophlebitis of inframammary vein that is not associated with discharge. Fibrocystic disease, there is no bloody discharge. So most probably correct answer is this one, lactational mastitis. So here correct answer is B. Clear? In fibrocystic disease, what happens? There is serous discharge. Mondus disease, superficial thrombophlebitis. So correct answer is B. Clear? So guys, it is B. Okay. Next, spread of prostate cancer to lumbar vertebra is via, tell me, it is via venous spread, right? From prostatic venous plexus, it is going to internal iliac. From internal iliac, it is going to Batson plexus. From Batson plexus, going to lumbar vertebra. So bone metastasis in carcinoma prostate, it's because of hematogenous spread and obviously via veins. Overall, if you see in here, in carcinoma prostate, since it is adenocarcinoma, lymphatic spread occurs, but for bone metastasis, it is venous spread. So correct answer is D. Clear? Next, patient with dilated tortuous vein of leg presented to OPD, diagnosed with varicose vein, grade 4A. What is the preferred treatment? So guys, 4A, Clinical is 4. Clear? So how to remember TV of pig lip? So in this case, what happens? There is pigmentation. Clear? What is the preferred treatment? So nowadays, gold standard treatment is endothermal ablation. So what is the preferred treatment nowadays? It is endothermal ablation. So correct answer is B, endothermal ablation. Okay. Next, ureter is safe in which type of hysterectomy? Okay. So guys, it is related to gynae. So ureter is safe in which type of hysterectomy? Yes. So this will be replied by gynae people, right? Next, identify the mark structure. You can see here. What is this mark structure? This is what? This is hepatic artery, right? So this one is left hepatic artery, and obviously this is right hepatic artery. And this right hepatic artery gives the branch. What is the name of this branch? This is cystic artery. So guys, this one is right hepatic artery. This one. This is right hepatic artery. So what is the correct answer here? This is right hepatic artery. Clear? So this is common hepatic. After that, this is left hepatic. This is right hepatic. And you know, this right hepatic gives cystic artery. Okay. Now see the next question. In a follow-up case of prostate cancer, we need to check what? PSA. So what we do? Prostate specific antigen. So generally we go for PSA. So it is DRE plus PSA. So correct answer is B. So guys, these were the questions. If you remember the other questions also, please share the exact language. We will be uploading the questions with all the options soon. Thanks. Thank you very much for the questions. Relax, take rest. Definitely you are going to crack this exam. Definitely you're going to pass this exam with flying colors. Best wishes from the whole PrepLadder family. Thank you very much.